Hello, my dear beautiful viewers, and all my dear nursing aspirants. Welcome to my channel, Nursing Tutorials. Through this channel, I am going to provide you notes on each and every topic related to Bsc and GNM nursing. Don't skip anything from the video, then you can understand and you will gain knowledge something about what I am going to teach or what I am going to convey with you all. So my dear nursing aspirants, if you like my video, please like, share and subscribe my channel, and don't forget to click the bell icon. Now let's move on to the video. Today, our topic is Unit 1, Introduction to Health in Fundamentals of Nursing. In this unit, we are going to discuss about factors influencing health, stages of illness, causes, healthcare services in India, healthcare team, healthcare agencies, and types of hospitals. Now, see the first slide. In this we are having factors influencing health. Okay, first of all, see what do you mean by factors and how they are going to influence our health. Factors are nothing but the things that affect our health. We consider them as factors that are going to influence our health. Here it was subdivided into two types. One is internal factors and second one is external factors. So, first of all, see what do you mean by internal factors? Internal factors are nothing but changes occurring inside the body we consider as internal factors, and these are inside our body and maybe disturbing our functions like that. So, indirectly or directly, they may be influencing our health to be sick. Okay, here it was subdivided into three types: one biological, psychological, and third one is cognitive. Now, see what do you mean by biological factors mean? It is nothing but aspects related to your body and its functions. Those are the things related to your body and its functions. Okay, and psychological factors. So, psychological factors means it is nothing but factors related to your thoughts, emotions, mental well being. Okay, thoughts, emotions, and what you are going to think, or what are the emotions you are feeling, everything like that. Now, see the third one, cognitive factors mean. Cognitive factors means aspects related to thinking processes and mental abilities. Okay, it's completely related to our thinking process and mental abilities. Okay, what we are going to perceive and what we are going to think about it and what is our mental health will comes under in cognitive factors. Till now you can understand that what do you mean by factors and how many types it was subdivided into. Now I will summarize what is about internal factors. See, biological factors. You already know that what do you mean by biological factors. Okay, what do you mean by biological factors? Those are nothing but body functions or inside what was happening in your body considered as biological factors. And psychological factors, aspects related to your emotions, feelings, okay, mental well-being. And cognitive, what you are going to perceive and how is your thinking process, mental ability, like that. Now move on to the next slide, external factors. Now see the external factors. Till now you have learned about internal factors. Internal factors are nothing but functions or any changes occurring inside our body will responsible for affecting our health. Here we are taking external factors means the factors those are affecting our health from outside of the body, we call them as external factors. Here it was subdivided into four types. First one is environment, second one is standards of living, third one is family, and the final one is cultural beliefs. First you will see how your health will affect by the environment. It will affect our health by pollution, climate, and our living conditions. Okay, these are the conditions or factors indirectly influencing our health. Now, move on to the next one, standards of living. Standards of living. Okay, it is nothing but economic conditions that will influence our overall well being and quality of life. For example, poor and rich. In our society, we are having two communities. One belongs to poor and another one is rich. Among them, the poor cannot afford anything, but the rich can afford anything. By that, we can know that the quality of life will improve to rich people and it was decreased by poor people who are living in poverty because they can't afford for good health, they can't afford for good food, anything else, but the rich people can afford for good nutritious food. In that they will improve their quality of life and standards of living. Okay, now see the next one, family. The family will affect our health by any influences from relatives and household dynamics. Okay, now move on to the cultural beliefs. Cultural beliefs affect our health by values and traditions which are embedded in our following culture will shape our health related beliefs and practices within a community or society. Through this, you can understand that what is internal factors and what is external factors. See, our next subtopic is stages of illness. Stages of illness is five stages. Okay, first stage is client experience symptoms. In this, client is going to experience the symptoms. Next, stage 2, assumption of the sick role. In that, client is going to perceive his or herself about the symptoms and what the disease going to be diagnosed. Next, stage 3, it is medical care contact. In that, client is going to interact or engage with the healthcare professionals or any other healthcare personnel to get treatment about their illnesses, etc. Okay, next, stage 4, dependent client role. In that, someone from the external environment going to take care of that client in their daily activities and managing herself. Next, stage 5, rehabilitation. It is a process in that client is restoring their health and it will help individual to regain their previous health after a period of injury, illness or anything else. Next, move on to the next slide. So, our next slide is causes of illness. In that, we have 5 points. First one is nature, severity, duration of illness. It is nothing but nature refers to a character of an illness and underlying causes. Severity is nothing but seriousness of the illness ranging from mild to severe. Okay, and duration of illness nothing but how long it's take to cure or how long it takes to last. Okay, nothing but short term or long term, chronic or acute illness. Next one is financial demands, and the third one is lifestyle changes, and the fourth one is adjustment to usual rules, and the final one is attitudes of client and others. Now move on to the next slide. Here in the next slide, we are having healthcare services in India. In India, what are the healthcare services are going to provide for an individual? First one is mental health care and dental care. It is nothing but deals with psychiatric cases or any other mental abilities. Dental care, you know the dental caries, etc. And next one is laboratory and diagnostic care. It is nothing but for testing any virology, serology or diagnosing various diseases and all. Next one is substance abuse treatment, nothing but rehabilitation centers, okay, for addition cases. Next, preventive care and nutritional support, providing nutritional support to children and pregnant women to carry healthy pregnancy and children for to grow healthy, okay, healthier way. And next one, physical and occupational therapy, establishing of various therapeutic centers to regain their health in a normal way, okay. And next one is pharmaceutical care. Pharmaceutical care is nothing but providing medications for various diseases and all. By providing those medications, they can get that medications freely, and they can overtake their illness and will be healthy. Okay. And next one is transportation and prenatal care. In that, government is going to provide medical attention and support for pregnant women. Why means to ensure a healthy pregnancy, because nowadays children are the flying colors of our future, right? So if the pregnant women are healthy, well nourished, and getting more nutrients, means it will help to deliver a healthy baby. And so in next slide we are having healthcare team. By showing the above diagram, you can clearly understand that who will be there in a healthcare team. First of all, first one, physician. Next, nurse practitioner. Next, nurse. Next, pharmacist. Next, social worker. Next, physician assistant. And in the middle we have patient and family caregivers. These are the members included in healthcare team and in a clinical setting. Okay. With all these members only we can provide equality and protective care to each and every single individual with our full efforts. So in the next slide we are having types of hospitals. Types of hospitals and classification of hospitals both are same. In this we are having four types. Okay. In that, first one is according to ownership or control. It is nothing but having control over it and decision making. Okay. Power of having control and power of having decision making. In that, its subtypes are government hospitals, voluntary hospitals, private hospitals, corporate hospitals. Okay, these are the hospitals having their own ownership and control to decision making and decides to do everything. Now move on to the next slide. In that next we are having second type of hospitals. In second type we are having according to clinical specialities. Nothing but specialized in a particular area or medical condition. Okay, these hospitals are owned by them. Next one is according to length of stay. Nothing but duration and terms of your stay. Okay, how much period you are going to stay in a hospital and what are the terms and conditions are there for it. Okay, next one is according to teaching and non teaching. See what was going to teaching hospitals have and what's not going to non-teaching hospital have. Okay. According to teaching hospitals, the ownership means combining patient care with teaching doctors. In that, ownership is including patient care along with teaching specialty, and we have control involving in teaching hospitals are overseeing both medical and medical education and patient treatment. Along with both medical education and patient treatment, it is having control over it. In non-teaching hospitals, ownership is about mainly patient care. In simple words, we can say that it is only deals with patient centered care and managing health services. Through this, we completed our whole class. Thank you one and all for patiently listening my whole class. Okay, thank you.